being here so early for this important yet often neglected topic of transit. I'm Karen Kendrick-Hands, and I'm kind of a newcomer to Madison, Wisconsin. This was a grandparent relocation for us. We lived in Detroit for 30 years and raised our children there, one of whom is a real transit geek, and that has a lot to do with why I've been working on transit. A little survey, and the panelists can participate too. Let's talk about the last time anyone here was on a bus. How many have been on a bus in the last week? Ash and Denise, and Larry and I, actually because of Larry and I took the bus this morning. I wasn't well enough to walk. How about in the last 6 months? Does that widen the circle? Wow, that's 100% participation. So I don't have to ask the question of can't remember when, and I know that Cassie and Scott, our dear neighbors, biked here this morning. And one of the good things about modern transit buses is some of them have bike racks, which makes the two modes work much better together. How many of you have experienced a period of lack of mobility in your lives when you didn't own a car?
I don't own a car.
Didn't own a car.
Ash? Okay, Cassie's had one when you haven't been able to get around. And do any of you live where there is transit but you don't use it? Okay, perfect. We're so glad you joined us this morning. I came to transit advocacy in Detroit because I cared about air pollution, and when I was looking at inventories of air emission sources, I saw that transportation was a lot of them, and it seemed to me that if we had better public transit, we might have better air quality. You missed the bus survey, Lori. Have you been on a bus recently?
Yeah.
Good. So I was looking at transit as a way to reduce air pollution, which was my legal specialty. My son was interested after a summer, 2 weeks in Paris, somewhat unsupervised at the end of 6th grade, writing the entire Metro Paris system. He loved the freedom it gave someone too young to drive and saw transit as critical to urban fabric, community foundation, and especially social justice. A major challenge, the biggest stumbling block to transit improvement is getting enough money to pay for it. And the fact that in the funders' view, we invest in roads, but we subsidize transit. And that's a reflexive subliminal bias that it's just automatic. Even the transit planners, the people who want to talk about more funding for their systems, talk about how much subsidy will be required, as opposed to what are we investing in when we put public dollars into transit rather than roads. So our panelists are names in their order this morning, and to not waste time on introduction, I'll just tell you, Becky's going to give some background stories of people that her agency serves but could serve better if transit worked better.
Somewhat, and also the challenges of lower income mothers who are trying to use transit for their
Amanda, as as the program manager at the YWCA, is going to talk about what her system actually does deliver. When I'm at the Downtown Rotary Club here in Madison, I say, well, we really have to talk about transit. And they say, well, the Y does something with that. And that's and they say, so the problem is solved because the Y does something with that. And Amanda's going to put some facts and figures on that. Denise, who's with us from the Wisconsin Council of the Blind and Visually Impaired, and I need to apologize up front with all the layers putting the program together. The name of her organization was misbegotten. It is the Wisconsin Council of the Blind and Visually Impaired. Of the blind, not for the blind, and impaired, not other words which we'd rather not use in that context. She's going to give us a view of her particular community, but also a statewide imperative to do something about it. And Ash is our numbers guy, and he's graciously agreed to be the token this morning at our women's conference. And our thanks to 4W and the Gender Conference for hosting us. Becky.
Great, thank you. I'm Becky Steinoff. I'm the director of the Goodman Community Center, which is on the east side of Madison, just off the Capital City Bike Trail. So we also have lots of bike transportation to and from the center, as well as public transit. We serve about, and I've been there for 28 years now, and I've seen just tremendous changes and growth in our center and in the community. We serve about 30,000 different individuals annually through all the resources we offer at the center. Some of those are core, they're every day. Many of them are coming for particular events or programs that are there only maybe once or twice a year. And of the people who are core to the center, the vast majority are lower income residents from the east, north. And actually, one of the things that's happened in our building is we now serve people from all over, so transportation has become a bigger challenge for a lot of our customer base. On the third, how do we move the slides forward, Ash?
No, just, I'll move them.
Oh, okay, well you can, if you wanna go to the second, sorry, I'll tell you. So I did already talk sort of about the second slide already, I didn't know they, but of the low-income customer base, the majority of the, we serve our children, and beyond that are the parents who are and guardians who represent those children. And more than 80% of people who come to the center are low income, and often transportation represents a significant challenge to getting their kids to childcare. We can move on to the third slide. To getting to the food pantry that's at the center. If you think about your mornings and your days and the hecticness of getting going in the morning, imagine doing that when you are relying on public transportation and you have children who need to get to the public school, you have children who need to get to the center for childcare, you may have a teen you're supporting getting ready for school to get off to high school or middle school, and trying to make that 7:35 bus with your two children. It creates significant challenges, and it is not uncommon at all for for us to be working with people who are in danger of losing their jobs because they just can't, or making a decision to send their children to childcare that might be closer to their homes, but is not the quality they're looking for. So they're making sacrifices in many ways for their childcare. I was talking to our staff who work directly in childcare, and they were saying that it's probably almost on a weekly basis that they're supporting some family, whether it's they can't call because they can't pick up on time, they miss the bus, or that they are going to be in there that day because their kids they missed their bus, they had to call in sick. And how often it is that women in these situations just don't have the flexibility and they end up losing their jobs. It's not uncommon at all that we're dealing with women trying to juggle transportation and end up losing their jobs. The fourth slide, not only does it mean, you can go on to the fourth slide, back, sorry. Should be two women, a mother and daughter, sorry. It's not, it somehow missed all right, never mind. We don't have to, anyway. A woman named Nicole, who had been coming to the center for a long time, she was actually working at McDonald's, which was close to her home, and was called and wanted to know if I'd be a job reference, because she was so excited. She had an interview at American Family, and she was offered the job, and then she tried to work out transportation out to American Family, and actually had to turn that job down because she could not juggle getting her kids off to public school, getting her kid to the center, getting out to American Family on one bus line that runs irregularly and meet the job requirements. And that's another challenge. We are right next door to Madison KIPP. They have decent paying jobs out in Sun Prairie. We're trying to work out our arrangement with them to use our vans to get workers out to the Sun Prairie plant because there isn't public transportation out to that site, and the majority of people who would be taking those jobs would be wanting public transportation. So creates a barrier to better paying jobs as well. And the other thing that I think is really important to put into this is when people begin to earn enough money, one of the first things they want to do is go buy that car. And it's because it simplifies your life. You get to leave when you need to. You can stop and pick up milk. You can do all the things that people who have more flexibility in transportation can do, but it ends up often costing them more. They also have challenges because their cars break down, because they're not buying cars that are reliable, or they don't have enough money for gas. But it isn't just a convenience thing in a lot of families, and then it's seen as a step up economically to be able to own that car. And we hear often, oh, I'm so glad I'm past being on that bus. And they're not, it is seen as a step out of poverty to not have to rely on the bus. And that's, I think, a big issue within our big segments of our lower income communities, and something that is, I think, needs to be thought through and problem solved, and figure out how you make transportation more friendly and expand it more so it reaches out, but also then help people recognize it's a choice you want to make if you can, because it's better for the environment, it's better for your cities. But there is a psychological barrier, or so to speak, from people moving up. They get that better job, and literally the first thing they want to do is go get that car. So that's really my.
Oh, thank you, Becky.
Sure.
Painted a good picture, and to put a price tag, Ash was shared a figure with us. The average annual cost to own a car is now up to $10,000 a year. So while it seems like a gateway out of poverty in the next step, in many cases you become a wage slave to your automobile. And the math of how that works is something that people often don't factor in when they're picking their location. They may say, well, the housing is cheaper out here, but then I need a car, and so when you add the two together, you're not necessarily coming out ahead.
Exactly. And actually that's a really good point, because another challenge for low-income families in transportation is housing in the city of Madison, we all know, is extremely expensive. So in order to find affordable housing where they're not homeless or living in substandard housing, they need to move to Sun Prairie or Verona or out. And so,
any place outside the Beltway.
And transportation becomes even more challenging. There aren't public bus lines that go out, and if there are, they're incredibly irregular. So it ends up isolating them from resources they really need.
So thank you, Becky. And with those issues in mind, Amanda's going to tell us how the program that you've been managing for how many years now?
So I've been with the YWCA 7 years, but I've been doing transit for 4. I actually started at the YWCA as a part-time driver, so I was driving for the program that I'm now managing. I was doing that while working full-time elsewhere.
So you have total experience with how important your service is and how difficult it is to both provide it and have to rely on it.
Yes.
So take it away.
All right. Ash, can you go to the next one? So I'll just start by talking about, majority of our rides are for our job ride program. It's taking low-income people to and from employment. Like Becky was talking about, most of our rides are coming from outlying areas, and depending on where their employment is, because not only if people do live in Madison, a lot of the jobs are outside of Madison as well. So we do pre-scheduled rides, and they have subsidized fares. So we're funded, our funding is really hard to explain, but partially we're funded through a capital grant with the City of Madison Metro. They helped us purchase vehicles, and so we do not duplicate services for people who can take public transportation. So one of the first things we do when people apply is to look and see if they can take the bus, and majority of the time they can't. That's why they're coming to us in the first place. So fares start at $250 per ride, so it's comparable to public transportation as well. We often get applicants that are women who are single mothers who need to get their children to childcare first, and it creates challenges for us too. We do several rides where we are dropping kids, but often, as we talked about too, is that the childcare is not necessarily near the home or near the job. So we're making another stop along the way, and it's sort of a scheduling nightmare. And I can't imagine if you were trying to do that on a bus because we're door-to-door service. So, can you go to the next one too? Thanks. We also do sexual assault prevention rides. That's where I started with the program. If you're familiar with Old Madison, it was formerly Women's Transit. And so we took over that program, and that's what started YW Transit with the YWCA. But we were finding that women were getting rides from, second and third shift jobs, and that's when transit as a whole came to light, because we realized women were taking it not necessarily just for the safety and for personal reasons, they were taking it for employment, so it expanded. We operate 24/7 now, but we do offer sexual assault prevention rides still. Women can call in between 7 and 8 p.m., and then rides are every night from 9 p.m. to 1 a.m. We still find a trend that people are still just waiting to get into the program, so they're calling for rides home. Often healthcare jobs and CNA jobs are majority of the women who are calling because they work these odd shifts or swing shifts, or their schedule's not set, so they're picking up shifts and just need a ride a lot of nights. Those are only in city and town of Madison, and then female drivers are the people who are taking these clients, and they're free. We used to charge the fare when women would call and say that they were getting picked up from their employer, but we eliminated that, so those rides are free. We also do coordinated community transportation. We found that there's obviously more access to the bus during like traditional office hours, so our vans were sitting and not being used. So currently we do some rides for Commonwealth, which is an after-school employment program for teens, but we also do during the school year for the middle college program. Those are area high school students in Dane County who spend half of their time at Madison College getting credit. So we're doing some transportation for them during the school year. We can go to the next one. So the numbers. So last year we provided 27,000 rides. Typically we serve, I would say, around 100 clients per month, which it doesn't nearly touch the amount of people that need to be assisted. We've been having a waiting list for almost 2 years, so people who are applying are automatically waitlisted. I probably still get 3 to 4 applications a week, even though our website says you'll be waitlisted. We have 8 vehicles, so like I said, Madison Metro helped us acquire some of those, but we have 4 that are 15 passenger, and we found that we weren't always filling those based on the routes, so we now have 4 minivans as well, and that's easier to kind of schedule, and we can fill those up easier. We're not wasting space and gas. So 50% of our riders are female, and then 70% of those are people of color, which just points to inequities in Dane County. And then I'll go to the last one. So our challenges, I talked about funding. We've had trouble with funding, as any nonprofit in Madison probably has at some point. But transit in particular, because we have all of these different funding sources, we're funded partially by Dane County, partially by, our fares are just such a small part of our funding as well. We're not charging the riders the actual cost to ride. So what can people do is we've always been working towards employers paying part of the transportation costs. I've been to different meetings where employers are saying, I just can't get people, and we talk about transportation as a barrier, and I think there has to be more willingness to fund some of that transportation. We can get people to work with you, and it's reliable, and you have to look at that. Do you want reliable employees that are going to get there on time? It's, we drop people right at their employment. And then support public transportation initiatives. I guess the biggest thing for us is that people aren't applying just because of ease of service. They cannot get around on public transportation in Madison, particularly in those pockets that are underserved. And you go to meetings, and even Madison Metro will have maps where, I mean, just the outlying areas are just underserved. There's not regular bus service, and like the jobs that people are getting are at times where the buses just aren't even running at all. A lot of our rides are one-way rides, so people can get there during the day. Say you work 2 to 11 or something like that. We do a lot of stuff for like UW Hospital for people who clean there, because there's no bus service after, you know, when they get off work. We're out there several times in night. We're out there at 11, we're out there at 12:30 because the shift gets off at different times. So they get there on the bus, but they can't get home. There's just no service, and the cost of parking, even if someone does have a vehicle, is just outrageous. So,
have you ever documented that and shared that with the hospital in terms of looking at grants?
We have, and we've talked to different, especially when it's a trend. Our best way to get people on has been word of mouth. So they see a van out there picking up people, and so they're telling different coworkers who have trouble with transportation. The conversations end pretty quickly, unfortunately. There's not a lot of buy-in because we're just doing something already. But that's, I mean, it would really help with our funding if there was some, you know, someone helping us. Yeah.
That's a really good point. Good done.
Yeah.
Great. Thank you, Amanda. And one of the things that she pointed out is another invisible subsidy for cars over transit. And that's if you're an employer and they drive there, the employer usually doesn't charge you for parking in their parking lot if it's a surface parking lot at a manufacturing facility. There's a cost to the employer for that, and yet that investment they're willing to make in a car-based worker, they're not willing to match for a transit-based worker. And it even took a long time for the tax code. Employers could deduct parking expenses for employees, but it was a really hard push to make it also possible for an employer to deduct a transit pass for their employees.
Safety of women, you know, instead of sexual assault prevention, this is a subsidy to rape culture, because we can all tolerate rape culture more when the people who are most at risk have these little, it just keeps the tap on things. And so really this is, you know, where it is used because people are unsafe, it's just facilitating people who want to misbehave in streets in a way that makes people feel they have to do that.
It places vulnerable victims right handy for them.
Yeah, and it makes it more vulnerable for those who wanted to know. So you take those people onto taxis or whatever, I mean, you're helping the people know how to solve their problems, and some people still have to walk that walk, and it's making it more vulnerable for them. So it's just another way that we should be thinking holistically. So it's a really great framing what you're all doing. Really appreciate it.
Are you on now?
I just have one more comment just to what you said. Also the fact that, you know, if people are stuck at home without having any way to get places, oftentimes they're stuck in a situation where they just can't get out of due to a lack of access to transportation.
Exactly.
Sometimes transit can be part of an escape plan if you're in a bad situation. So, yes.
Yes, and it's through analogy with other systems such as the healthcare, medical care system, is so what people who are not employed or who lose their jobs going to do, stay-at-home moms, single moms, at least temporary, those who lost their job, they still have to get their kids to school or to daycare, whether they go to work or not. So just subsidies by employers are not feasible. And the same is with healthcare.
So
when you don't work or you're homemaker and you don't have others readily available, what are you gonna do? You deserve to die?
Yeah, so I think it's Melita, right? Makes an interesting point that we shouldn't just be turning to employers. At the same time, within the employment realm, we'd like to see a level playing field between folks who drive and folks who don't drive. And Denise is here from the Wisconsin Council of the Blind and Visually Impaired. and you represent a community that doesn't drive.
Correct. So step out of poverty isn't going to happen with a car because a license isn't going to happen for people who have visual impairment. So I am Denise Jess, the CEO of the Wisconsin Council of the Blind and Visually Impaired. And in addition to being the leader of that organization, I'm a woman who is white. I'm the mother of 2 young adult daughters, and I also am a person with disability, being a lifer as someone who is visually impaired with a congenital birth defect. So the issue of transportation is not conceptual for me. It is an every single day experience of how am I going to get my groceries? How am I going to get to the credit union? How am I going to get to work? How am I going to have social time with friends? I'm a big nature lover, so how am I going to get out of the city so that I can go hiking or go kayaking? How am I going to get my kayak to where I need to go? Just every single day.
Can't take it on the bus, Denise?
No, I haven't figured. It doesn't fit. I haven't figured out yet how to fit it onto the bike rack.
And it doesn't fit on your bed either.
This is Madison, if it can be done anywhere.
Right,
it'll be done
exactly. If
there.
you can take your kayak someplace on public transportation, it would be here. So if I calculated how much of my time every single day is invested in the cognitive process and then the emotional process of making decisions about how I safely get from A to B to C, it would be astronomical, because even yesterday, as I prepared to think about coming here, and I'm in this building a lot, I still took time out of my day to examine what my options were, especially at Saturday bus service, and to explore those, and 15, 20 minutes later and having an option. So just that luxury of hopping in the car, grabbing the keys, is an unknown experience to me. So the Wisconsin Council of the Blind and Visually Impaired, just to give you a little bit of context, because my population is often invisible in society. So we span, I'll give you some stats in a minute, but I'll just tell you about the agency very briefly first. We have been around since 1952, so we will celebrate our 65th anniversary this year, so 65 and still serving. We are a statewide 501c3 nonprofit. We are not a state agency. So as is true for my cohorts here, we are very reliant, the council is nearly 100% reliant on individual donors and trusts and bequests. We get very little public funding, just a tiny bit from the state and the federal government to provide vision services. So we are completely reliant on the generosity of this community. We really support the dignity and independence of people in the state who are blind and visually impaired. We do that in 3 primary ways. One is legislative advocacy. The second is vision services. There's so much more that can happen for someone after they leave that ophthalmologist's office and the ophthalmologist says, there's nothing more I can do for you. There's quite a bit that we can do beyond about how to really utilize functional vision. And then education, and a lot of that education comes to the sighted community to help folks understand the capabilities and gifts that people with visual impairment bring, as well as the challenges that we face. And we are guided by core values of inclusivity. I often say the one thing that binds all people with visual impairment is visual impairment. That's it. We are across color, we are across age group, we are across socioeconomic group, though a good portion of folks are living in poverty or low economic means, and we cross gender and we cross age group. So the diversity among our population is huge. Politically, we're the full spectrum. Religiously, we're the full spectrum. And our other core values are uncompromising respect and integrity. The level of subtle and not so subtle disrespect given to people with disabilities is phenomenal. So that's a presentation for another day. So Just to give you a sense of the numbers, since this is an invisible population in Wisconsin, and these are 2015 numbers, there are about 100,000 of us who experience significant life-altering vision loss. Some of that and the primary sources are congenital, so folks like me who were born with a birth defect and will never acquire, typical quote-unquote vision. Folks who experience some kind of injury, traumatic injury at some point in their life and may or may not surgically recoup vision, and folks who have eye disorders or eye diseases of some sort. Some of them are genetic, some of them are not genetic. And of course, with our aging population, we expect to see the numbers of folks living longer who experience visual impairment. Any of us in this room, any of you in this room, could experience visual impairment as you age, and I could experience additional visual impairment as I age with macular degeneration or any of the other degenerative eye diseases. So you'll see that there are about 8% of the kids in the state who experience blindness and visual impairment, and that's often the congenital or traumatic injury. 51% of our population are working age adults. And then 41% are folks who are our elders in the community. The numbers that always just make my stomach hurt and make me take a deep breath in is that 70% of folks who are classified as legally blind are unemployed on a nationwide basis, and it's true in Wisconsin as well. 92% of people who experience low vision and legal blindness are underemployed and unemployed when you put those two sets of numbers together. So I am in the fortunate 8% of people who are legally blind who are gainfully employed. I have been my entire career as an educator, as a small business owner, and now as the leader of this organization. And I have a lot of gratitude for being in that minority and a lot of grief for knowing 92% of the population is working sub-minimal jobs or unemployed entirely. So transportation is the link for so many aspects of our lives, and Becky and Amanda have done an exquisite job of naming some of these things, so I want to just highlight them through the filter of disability. Employment is a big one, and so with those unemployment and underemployment numbers, Becky, your story of folks declining the job at American Family rings true. There are folks that might be offered a job and have no way to get there. I was recently talking with the CEO of the Industries for the Blind in Milwaukee, and getting her workers to and from her facility is always challenging, and so she's exploring ways to have some skin in the game herself as an employer of running van pools and getting folks to her work site, because she knows that the public transportation that most of them use in the city of Milwaukee as it merges with West Allis drops her workers who are blind and visually impaired a half a mile from the facility. So a half a mile walking with a cane or a guide dog is an eternity. So try it sometime. So it is imperative to have transportation available for access to employment. If you are in an employment program, a training program through the Department of Workforce Development Division of Vocational Rehabilitation, you'll get transportation covered for the first 90 days of your employment. Hopefully you're going to work for that employer longer than 90 days if the state has made an investment in your training and your job placement. But after that 90 days, the pool of money designated for you goes away. And so if you were placed with an employer that it doesn't have access to transportation, a lot of times you need to let go of that job or figure out how to cobble together transportation. Healthcare, same thing, you know, so how often are we finding substandard healthcare because it's like, well, this clinic's closer than this one, or I just simply won't go because it's too difficult to get to and from the healthcare. In the city of Madison, I'm a group health member. And so group health is very proud of itself, and I will out them on this. I have no qualms about doing it because it's an issue I've raised with them for 25 years. They have placed all of their clinics somewhere on a bus line. However, some of the outreaching clinics are on tertiary routes, which means that they run out to the clinic about every hour and a half or so. And so if I want to go see a physical therapist, and those are placed in those outlying clinics, not down here at the Capitol Clinic, I need to get on the bus, spend an hour and a half getting to, and then often the bus stop is not right next to the clinic. It might be a block or 2 or 3 or 4 away. Get off the bus, make it to the clinic, again, visually impaired, in neighborhood unfamiliar to me. Get to the clinic, get to the appointment's 20 minutes, go back to the bus, another hour and a half. So, yeah, exactly. So we're looking at a half a day.
For a 20-minute
for
appointment.
a 20-minute appointment. Or if I cab, because I do not, you know, qualify for any economic subsidy, there's that word, that is often a $25 cab ride one way, let alone both ways. So the expense is phenomenal, but yet group health will tell you all of our services are available on a bus line.
route.
If you're receiving Medicaid subsidy and you go to the clinic and you were able to use the Medicaid transportation, but you need milk from the grocery store, so sorry, that transportation will not allow you to stop at the grocery store, pick up that milk, and get home. It is door to door between your place of residence and the healthcare provider. So now we need to arrange another ride so that you can get your milk. In addition, you know, those daily life activities, and then of course the social ones. So you want to get to an activity in the evening, or you want to get out of town to go do something. You know, the issues are obvious. So when you plug together cost plus time plus lack of options, the end result is isolation and dependence. There's a lot of stress in families around transportation for people with disabilities, and so, you know, I'll hear legislators and folks in the public say, well, you know, you have a good family network, why don't you just ask so-and-so for a ride? Yeah. And so, you know, when you talk with folks, there's a lot of family resentment on both sides about needing to ask again. You're asking again. Or gosh, I'm embarrassed, I don't want to have to ask again. So yeah, the family stress around that is significant. So what can we do? I know Ash is going to talk about these from a systems approach. I'm going to talk about them as an individual citizen responsibility approach. So one is ride sharing. So when we're planning events, you know, social ones, or even events, conferences, or things within our faith communities or our civics groups, how are we taking responsibility as organizers for bringing transportation into the conversation? I love that this conference is at the Pyle Center. It's an easy one to get to from many places within the city. There are a lot of events where that has not been taken into consideration, and then when I raise it, it's like, oh, didn't think about that. Well, you'll figure it out. You know, you're good at that. Yeah, thanks. Pedestrian safe neighborhoods. So of course there's infrastructure issues around creating pedestrian safe neighborhoods, but there's also driver responsibility. So as individuals, really taking into account, are you behaving in a way as you travel through neighborhoods that promotes those being walkable neighborhoods? I live off of Williamson Street on the Isthmus, and when I go to work in the morning, the council office is on Williamson Street, so I have a pretty short walk to work. No matter which intersection I choose to cross at, and I always use a lighted intersection, there is a minimum of 1, often 3 to 4 cars that run the red light as I'm attempting to cross. So, they travel in packs. So I saw you run, oh good, I'll go too. And as someone who's dependent on listening for the car traffic to stop and looking at the light, I can't judge how quickly you're coming. And so then I need to wait or risk stepping into that crosswalk. So that's an individual driver responsibility that anyone behind the wheel can pay attention. Am I helping to contribute to people in this neighborhood feeling safe to be able to walk and get around? I chose intentionally to buy a home in a pedestrian safe neighborhood, which also costs me more money, by the way. So I live in that neighborhood. My property taxes next year will be just under $10,000. And my house is valued at just under $400,000, and it was like 89 or something when I bought it. But because I want to live in a walkable neighborhood where I can get my groceries, where I can get to work, where I can get to my credit union, where I can hop a bus when I need to, there's an economic cost for that. So tying back to what Becky had named earlier. A couple last things that I want to just name.
Denise, we need to
Are
wrap
we
it up.
done? Okay.
Yep, we are.
Yep. Thank you. So Ash, I'll let you
why
take
don't
it.
Why don't you finish up,
Okay.
because I have a very short presentation.
Okay,
Okay,
so
thanks,
thank you. So the last one is to really recognize that we need alternatives that get us beyond municipal boundaries. So again, Becky named it Getting to Sun Prairie. If I want to go see my daughter, who is a freshman at Northland College in Ashland, I need to bus to Minneapolis, and then I need to bus from Minneapolis to Duluth, then Duluth to Ashland. We laugh, and it's an overnight trip. We laugh that could get there sooner if she had accepted going to school in Asheville, North Carolina.
You could get there faster.
I could get there faster. Yep.
Oh, boy.
Yep. So, so really, and then that's where we start advocating to our legislators on behalf of connected transportation. So there's much more I can say, and I know I want to give the floor to Ash.
And as we transition to Ash, I got an alert from the League of Women Voters of Wisconsin yesterday. And there was a segue about how critical transit is to getting around, that we've been much more eloquent than that. But then I have this action alert. It says, contact your state senator and assembly representative and urge them to support public transit and keep it in the segregated transportation fund in the state budget. Ash, what does that mean and why is it important?
Great, I can take that and talk about it during the course of my few slides. My name is Ashwat Narayanan, and I am Transportation Policy Director at an organization called 1000 Friends of Wisconsin. We, like many other 1000 Friends groups across the nation, started as a group that was, putting together a law that was going to build more smarter, healthier communities through the planning process. And we did get that law into place about 20 years ago. And since then, our mission has somewhat evolved, and we now focus on trying to make the different connections between all of these different things that you see on the slide here, including neighborhoods, green infrastructure, natural resources protection, with the ultimate goal of building healthier communities. I focus exclusively on transportation at this organization because we really realize that transportation is key to building a community where where people are able to find economic opportunity, feel safe, are able to contribute productively, and also is inclusive for everybody. So, we've heard stories from all of the other panelists on here about the specific impacts of transportation or a lack of transportation has on either their own lives, their organizations, and the people that they work with. So, and what I hope to show you is how we have got there today. These are some of the some pictures that you can see of. These are all pictures in Wisconsin, which on the left side is a bus stop which has been removed because we don't have the funding for it anymore.
This location is no longer a bus stop.
Yeah. The second picture is a photo that one of our members took in Appleton, where somebody in a wheelchair has to drive on a shoulder of a major highway just to get to a food establishment on the other side, and they have to go through lanes of traffic under another major highway. And the other two are huge potholes and things that we see in our cities of Milwaukee, and I believe that's Appleton, which costs people thousands of dollars in maintenance costs for their cars. So how did we get here today? For decades, Wisconsin has been prioritizing investment and subsidies really to highways over every other mode of transportation. So we've been funding major highways at a much higher rate than anything else that we've been funding in the state of Wisconsin. You can see between 2000 and 2012, our major highway program funding has gone up by 45%. And at the same time, funding to local communities to either fix their roads for their public transit systems and any other local infrastructure that they, like fixing your sidewalks and things in front of your homes, has gone down by a corresponding 45%. So what does this mean for transit? If you look at 2000 and 2016, you can see that highway funding has taken up about 52% of the budget in 2000, and today it's 54%. Debt fund, how much we pay in terms of repaying debt we've taken out for our transportation system, has gone from 5% in 2000 to 16% today. And transit has gone from 6%, which is such a small amount of total $3.8 to $4 billion budget annually, 6% in 2000 to about 5% today. So essentially, our highway funding has come. We're funding highways at the expense of everything else in transit, everything else, including public transit. So we're finding that a lot of these highway expansions are not warranted. We see communities being destroyed by increasing lanes. Even the Beltline in Madison is being talked about being expanded, which means that houses adjacent to it are going to see a decrease in property value. We're going to see increases in air pollution. It's going to be harder for pedestrians and bikers to cross these large highways that cut through our cities. And at the same time, we are not fixing what we have. In 2010, there was a 10% across the board cut for public transportation in the state of Wisconsin. And that has just led to this vicious cycle of, because it's just not feasible to ride the bus, you're not going to take the bus. And so that means that then you're going to see state legislators say, oh, no one's going to take the bus. Let's cut more funding to the bus because no one's using it anyway. And it just leads to the cycle of less and less funding for transit. Just in Milwaukee alone, I think they estimate between 12 to 15,000 people who are going to be, who could be a productive member of society, going to be able to access all, going to be able to do all of these different jobs, who are just not able to because there is no way for them to get to their jobs. And we also hear a lot about people talking about putting more money into the system, so taxing people more for transportation. We hear, our roads are crumbling, our transit systems are crumbling, but really that's not where the problem is. We should not be unfairly taxing people who are already paying for their transportation more, unless we reprioritize how we fund our transportation system. So what we essentially need to do is take some of the waste and some of the unnecessary large boondoggle type projects and put it into our communities. So invest in our public transportation systems, invest in our local road infrastructure, invest in making sure that our sidewalks and our local roads are safe for pedestrians and bikes and anybody else who does not use a car, instead of raising more money and fees to pay for something that we may or may not use 20 to 30 years down the line. So what can we do about this? I think Denise talked a little bit about it, and Becky and Amanda did as well. But right now is a great opportunity for us in Wisconsin because the legislature is discussing ways to fund transportation. There's a for the first time in 24 years, the governor's budget proposal has actually been cast aside by a group of legislators, which means that essentially we're starting from a blank slate. So this is an opportunity for everybody who lives in the state of Wisconsin to go to community forums, call their legislators and tell them that transit is important to them. Transit is valuable to their communities, and it's not something that, you know, is welfare or social service. While it is important to make sure that everybody has access to transportation, it is also a valuable tool for the state of Wisconsin to be, you know, productive, to attract people and to make it a vibrant place to live. So, and you know, in our political climate, that sort of message does go a long way. So I would urge everybody who is interested in transit to look up where community forums are happening in your state, go to them, call your legislators, call your local elected officials, and try and put as much pressure on them to make sure that they communicate those messages to your to people on the Joint Finance Committee and other decision makers who will eventually make a decision on how much money should go towards public transit. So, yeah, I think we're at the end here.
Well, thank you. Kudos to the audience who came. 5 minutes left. I think I'd like some audience reaction on this. Is Malika,
I think,
right?
when I return as an alumna, here I heard that you almost succeeded with the subway budget, and it's been aborted at the last moment. I think this would be a great opportunity, as Ash mentioned, to revive the interest in that project, because this city expanded enough that, as somebody mentioned here, if you are to go, especially in a weekend, and I've been there, I'm still there, from North to South Madison, you might as well get to Milwaukee or even to Chicago, driving straight in that time that it takes you to get and transfer to 2 or 3 buses, and it takes forever. So the way you get through a large surface in an efficient way, you gotta have some subway, or at least part under the ground, part above the ground, but something like this.
I know there's been discussion about getting some bus rapid transit, which is a smaller city substitute for subway. It has some of the amenities of same level boarding, easy fare collection, that make it higher capacity vehicles. What happened to the plans for bus rapid transit for Madison, Ash?
There are plans for bus rapid transit, in that there have been studies, and Madison Metro has a pretty good idea of where they would like a bus rapid transit route to go. The problem, of course, is funding. I don't think we can expect any money from the state legislature, specifically in terms of capital investment costs right now, for any new transit system. And we were reliant on what was called the federal Tiger Grant program, which has been eliminated under this current administration. So that also does not seem to be.
And we did apply for a Tiger Grant for new bus maintenance facilities. One of the limits is there's no more room for buses.
Yeah, but I just wanted to make another point, in that we as transit advocates should be careful not to fall into the trap of trying to say, you know, if a subway is better or a bus rapid transit is better, or, you know, I think we can have those discussions amongst ourselves, but we in Wisconsin are so far behind in terms of funding any sort of public transit that I think it's important we put up a united front to the legislators to make sure that we get any sort of increase in public transportation, and not get stuck in the details of which specific
mode you want.
That's right.
That's an excellent point, Lori.
And I think Denise, you had a.
I did, but so that's exactly right, because the needs that we need to think beyond Madison, which is our reality, but there's folks in the rural part of the state who have significant transportation needs, who are much more isolated than we are. And so letting the counties have discretion, communities have discretion about what's going to best serve them is going to be really, really vital. One of the things that the council will be going to the legislature to ask for, and we've got a targeted legislator that is willing to help us, is an interagency transit council, so that folks from the employment sector, DWD and DHS and DPI, are encouraged and supported through statute to have conversation together to better network, because there's a lot of holes in the system as well. And so as we develop language on that and begin to push it out, it will be on our website. So I would also encourage you to take a look at that, because it's something also that the constituency can bring forward to say we would support this.
And Lori had a comment.
Yeah, I guess I'm very interested in learning from this panel, and maybe after the fact even following up with email. I think one problem is people who, some people, you're painting pictures of people who every day they're feeling it because they have to do what they have to do with buses. There's also a lot of people who just don't even realize how much this is impacting their lives because they don't really know what it's like somewhere else. What are there cities that you could say are model cities that have this? I'm particularly interested too with the interconnection with rural, people who are even slightly rural being able to get into town. Are there examples where it's happening right? Because I almost think Madison needs to see what it isn't doing in a holistic way, and what mid-sized cities are doing. It seems like this is a problem of mid-sized cities, and maybe Madison needs to kind of reimagine that. In some ways, Subway is saying, let's be like a little big city, and Subway is going to serve the people in the middle who have a lot of options already and are like choosing the Subway before your car more isn't really the issue here. It's moving or not moving. And so anyway, I'm just really interested. Are there cities that you would go live in because the transport really works for people who are visually
I think I'd
impaired?
ask Ash that question.
I mean, the U.S. in general.
Portland, Oregon does a pretty good job.
Yeah.
But it also has a growth ring.
So do we need to go to Europe for examples and models?
Of course.
Yes.
I think today the world leaders really are in Southeast Asia. So places like Hong Kong and Singapore are really the ones who are leading in terms of being able to have a holistic system that manages to. The key reason is that we prioritize the car so much that even if you put in transit anywhere right now, so for example in Atlanta they put a streetcar downtown and nobody uses it because there's just so much free parking available, there's so many freeways available that it just does not make any economic sense or even convenient in the sense of convenience to actually ride that public transit. So what we need to do, and Larry was telling me earlier this morning how in downtown Chicago that they've taken all these steps to sort of disincentivize car use. And so unless we make it a little bit harder for people to drive their cars to wherever they want to go, which has a lot of negative externalities on their environment, we cannot have a successful public transportation system as well.
Density is important to public
That's what I'm
transit.
thinking, yeah, so
And-
Hong Kong and Singapore have the density, right? So are they extending into kind of suburban rural areas? Where's the example of the solutions without the density?
I don't know the answer
so-
to that.
One of the things Chicago has done in its neighborhoods, not in its downtown, is when you want to build a new building, there's often a zoning requirement that says 1 parking space per bedroom. That makes the project that much more expensive for the developer. There are certain neighborhoods where the transit is good enough that they can say, you might not need to own a car anyway. We don't have to make our development more expensive by giving you not only the space you live in, but the space your car lives in. And so they take that requirement away, and the math of every project changes. There's more money
So
for
there's
affordable
planning
housing.
design
Right.
point.
It's also somewhat of a chicken and an egg. So many years ago, for Madison, downtown had nothing and State Street was failing. And one of the things that sort of revitalized that downtown was additional parking. So you have to change people's mindset about it before you can change so if you disincentivize people who drive, which is the culture here because of will stop coming here and they'll go, you were seeing nationally that downtown areas are getting revitalized and the outer ring mall areas are starting to decline. But somehow you have to change the psychology so people will still come downtown because there's good public transportation and so you're not killing the economic
Right.
growth that has happened.
Malia has
Actually, a comparable city right here in Midwest is Cleveland. Through a combination of bus and rapid transit, they are connecting very nicely, very well and efficiently Cleveland with suburbs and all the way to the airport they go. And actually people employees from the university and postdocs and assistant professors, not just the poor, are riding it, and it's something that everybody enjoys it.
Yeah.
I encourage everybody to look at the Cleveland.
Yeah, that's,
Yeah, and-
they have that health line that goes to the hospital as well, right?
Oh, that's huge.
Yeah.
Marissa?
I'm still collecting my thoughts, I think. Sorry.
So Lori, you are correct that there are very few models that actually look at rural transportation. So, I love the Cleveland model and, but again, it stops as soon as you get away from, those important centers like the hospital, like the airport. And so anyone in a really small community has very limited transit, if not zero transit options. There's a NPR story that I heard recently about a company named Liberty Transportation, and they are starting to spring up in like rural Nebraska, I think, and rural Ohio, and they partner with the folks who are called mobility managers for the county, using county infrastructure that's there, and then they're like a ride service like Uber, but much more directed towards people who are disenfranchised and much more affordable.
In Michigan, the neighbor across the lake, our transportation fund is taken out of the gas tax, and the Constitution guarantees up to 10% of the gas tax for transit. So you have 5% of the transportation budget. In Michigan, could be 10%, it's about 8% by the time they net it out. Every county has a paratransit connecting bus service. There's community transit in every county. And when I came here, I said, well, what about the dial-a-ride and paratransit? And I kept getting blank looks. So what I realized is it's a subsidized taxi service with a 48-hour advance notice.
Exactly.
And I couldn't believe that there was anything that could be worse than what Michigan had, but actually there is.
And the amount of money is based on the population of the county. So, so if you've got a little itty bitty county, low population, there is a floor to that funding, but it's not going to be what you can see in a higher population county.
Well, I want to thank you all for coming. I guess the first thing on your to-do list is figure out who your state senator and state representative is, and call them and tell them what was the League of Women Voters message.
Make sure you keep it in the segregated budget.
Make sure you keep it in the segregated budget. Everybody, I get the closing soundbite?
Yep.
Everybody is one car accident, traffic ticket, or breakdown away from being transit dependent.
Thank you.
Thank you.